skin, as long as it's intact, is a really good barrier to infection. And we have things like it's an acid pH. We have lysozyme that's secreted through the skin. Those proteins will stick to cotton. That's why your t-shirts turn yellow under the armpits. The sweat has a lot of salt in it. And all of those things inhibit a lot of bacterial growth. So you do have some organisms that live on the skin constantly, but most are just going to be transitory. They're going to be there temporarily. And they don't penetrate the skin very well. There are very few that have the enzymes necessary to break through that keratin and to get down into the lipids that are underlying that area. There are a few parasites that like to go in around hair follicles. We could talk about blood flukes in this respect. I don't care if you memorize the numbers there. That's something you can look up if you ever have to know it. So, epidermis. Stratum corneum, it's the thick dead layer of cells that are on top. We're constantly shedding them. Keratin withstands damage, abrasion, water penetration. It takes a while when you're soaking in the tub for your fingers to wrinkle up. It takes a little while for that keratin to take on some of that water, and you start getting water absorption. So it's a nutrient poor material. Keratin doesn't have very many nutrients. Not many organisms can break it down, and you put bunches of layers. So imagine I build a plastic grid on top of this thing. I can lay my hand on top of that plastic grid, and I'm not making contact with anything I can use because there's this barrier between me and it. You get some different layers in there. Just know the stratum corneum is the top layer. You're going to learn the structure of skin through this cross section in anatomy, so I will not test you on that. Will not test you on this slide. But you can see there's where most of the stratum corneum, that's where most of the dead keratin's located. The hair has to come through it. So right here, you do get some bacteria. If they can dissolve a little of that away, they can get in around the hair follicles. So a lot of the infections that we're going to talk about, a lot of your fungal diseases will go in, like your tinnitus will get in and form infections around the hair follicles. Sweat glands is another location where you can get smaller bacteria getting in there. All right, so we're looking at connective tissue in the dermal layer. You got to damage deep enough to penetrate into the dermis. We're kind of clumsy. We cut ourselves, we scrape ourselves. I bump into stuff all the time. So there are chances of this happening, but if we can block anything from getting in or treat it pretty quickly, that prevents problems. You have a lot of guys that work out in the field. Like I think of it with this one guy I saw. He came in, and all I was doing was taking blood, so I didn't really work on the patient. But he had been cutting wood out in the woods and cut his leg, and he waited all day long to finish his load before he went to see the doctor. And had this big, it was a piece of wood that long stuck in his leg. So, maybe he should have seen to that before he finished his load. But some people can be a little stubborn. All right. There are a lot of antimicrobial peptides associated with the skin, and remember, these can kill virally infected cells, fungi, bacteria, but they're not going to kill everything that's out there. Low pH, oily residue. If you wash all the oil, they used to think that you shouldn't take a bath that often because, then you're washing away all the protection you've got. So take a bath, please. For my sake, take a bath. You can lubricate up afterwards. Use something else. All right, let's see. Toxic byproducts of fatty acid metabolism. Oof. Fatty acids, they're fermented, stink to high heaven. Some people will have natural body odors. You gotta fight them, especially diabetics, people that have metabolic problems, they have to be very careful. I keep a spare shirt in my office, and I've got deodorant in my office, just in case. Because what happens is the fatty acid metabolism will start causing that sour body odor smell to occur, and it may not be their fault. Some people are just nasty, but some people can't help it. So, be careful when you're judging. If you ever smell me, please tell me and I'll go change. Let me know. All right. Sweat. Sweat is inhibitory because of the high salt concentration and the low pH. It's very acidic. Lysozyme breaks up the peptidoglycan, so gram-positives generally have a harder time on the skin than gram-negatives. But if you start looking at the number of common microflora on the skin, you have streps and staph are two of the biggies, and they're both gram-positive organisms. Okay. Normal biota of the skin, they're doing skin microbiome right now, and they're finding a lot more bacteria associated with skin, and it can vary between geographic region and race and sex. All of those factors can change the types of bacteria that grow. Age even. When you go through puberty in high school, a lot of people get acne. There's bacteria that can form the acne, and they respond to hormone levels, or pheromone levels even. There have been a few cases where they sent, in big cities, police officers that looked really young, they sent them undercover into high schools to check for drugs. That's weird in itself. I couldn't imagine trying to send me back to high school. God, no. I don't think I could handle that. All right, but they send them back to high school and they break out with acne again because they're exposed to all of those pheromones and things in the environment. Some people tried to claim they were fluorescent lights, but there were fluorescent lights in the police station. So it was around all those rabid hormones that are there. Maybe they should add some filters or something. All right. So let's look at the Human Microbiome Project, and it's shown the following genera on the skin: Streptococcus, Staphylococcus, Propionibacterium, which is an anaerobic bacterium that's kind of difficult to culture. One of the reasons it didn't show up much in the past is simply because we didn't run the right test to detect it. It wasn't looked for in the right way. Propionibacterium acnes is the organism that causes acne. It does respond to tetracycline derivatives. So a lot of people now are just cleaning the skin, and they're using antibiotic-laced salves and creams to try to get rid of the acne. So you have fewer people having the strong acne response that they used to. Corneobacterium, I always think of diphtherium. That's the one major pathogen there. Malassezia, fur is it's a fungal disease. Pseudomonas is pretty much everywhere. It's ubiquitous. It's on everything. So I think a lot of these are not permanent residents of the skin. They're more just transitory organisms. But these can cause major problems in burn victims or victims that have skin scraped completely off of them. And I know nothing about this last bacterium. So don't expect me to ask a question on it. I don't know what it is. It may be an organism I know that they've changed the name of in the last year, but I don't know it, so don't worry about it. Normal biota of the skin. It's more diverse than we thought. DNA methods are going to detect more of the bacteria than the old culture methods are. So there's that same list of bacteria here. All right, let's look at diseases. Maculopapular, flat to slightly raised colored bumps. Maculopapular rash diseases include measles, rubella, Fifth's disease, roseola, and scarlet fever. You rarely see scarlet fever, roseola anymore. You can see Fifth disease every once in a while. used to be there were 5 major causes of rash illness, and fifth disease, they didn't know what they had caused it, so they called it fifth disease. It was a milder rash that usually didn't cause major problems, but it was the 1/5 most common rash illness on skin. Because of vaccinations, measles, mumps, rubella, all of those are vaccinated against. The number of cases of those has dropped, except in populations like the Amish who don't get vaccinated for those. And for some of those idiots that don't get vaccines for their kids, we're seeing outbreaks of these diseases again. And yes, I just call them idiots. You can turn me in for using the I word, but I'm a big proponent of vaccines. They work. Just go back and look at the history. Measles, rubiola, at least 540 children die every day from measles, even though this is extremely effective vaccine's been available since 1964. Oh, admittedly, this is worldwide, but we're seeing an increase in the number of people that are dying in the U.S. because of the fear of getting the vaccine. In 2002, measles death had dropped by 74%. The MMR, measles, mumps, and rubella vaccine is the one, I can't remember when you get it. It's about 18 months. Is that right? They do it younger? A lot of times the people that design the vaccines think that if you give it before 18 months, it has less effect because there can be maternal antibodies still in the body that neutralize the vaccine. Signs and symptoms of measles: sore throat, dry cough, headache, conjunctivitis can occur, lymphatic swelling, fever response. You can have these red maculopapular. They're very close to the skin. They don't have pus coming out of them or anything unless the kids have scratched them or something. Progress to the trunk and extremities. It's hard to see. You can see it better on the TVs. But yeah, that's what the rash kind of looks like. Admittedly, that's a pretty advanced case. It can cause pigmentation of the skin. Yes, ma'am.
Back in the early 90s when we had that measles outbreak, remember that?
Is that in the 90s?
It was like late 80s, early 90s.
Okay.
I was in like 7th grade. I had it. I ended up with a double case because I got the vaccine and my friend also gave it to me. So I was like, I can't think what I'm trying to say. Had to stay at home. Couldn't go outside or anything for like a week.
Ooh. Yeah, that can be torture for a kid.
It was awful. They said that's part of the reason why my eyes are so bad. You're supposed to wear sunglasses even when you're watching TV. And I didn't. Nobody told me.
The reason that you have to do that is because any damage to cells is kind of an opening for the virus to spread. The cells are already weakened, so light can actually cause major damage inside the eyes. And on skin, if this guy were to go out in the sunshine with this rash, you get complete depigmentation, which is not so bad if you're white as I am. But if you're pigmented, if you've got darker skin and you look like a mottled person with white spots all over you, it can be kind of detrimental to, you don't want to take your shirt off in public ever again. It doesn't hurt anything, but it depigments. All right. Measles can have other effects: laryngitis, bronchial pneumonia, bacterial infections such as ear and sinus. Pneumonia would be a secondary infection. Encephalitis resulting in coma, but that's usually in advanced cases. Remember, a lot of people survive this. It only has a mortality rate of about 20%. I'm guessing at that number. The CDC will have a more accurate number. Okay, let's see. Neurological degeneration. It's very bad if it gets into a developing fetus. So if it's more of a congenital type thing, then it can be really bad because it can cause mutations, can can cause brain damage. 1 in 1 million measles infections. It's involving a defective virus, causes intellectual and neurological impairment. And like I say, it's more of a problem in really young people than in older people. We have more brain mass, so we can absorb a little bit more damage than, say, an infant. Okay. Measles is morbillivirus. It's in the family paramyxoviruses. They're single-stranded enveloped RNA viruses, and they mutate rapidly. Single-stranded RNA is highly mutagenic. It's not mutagenic. It's easy to mutate single-strand RNA. Mutagenic has a different connotation to it. So it's one of those kind of bad viruses you don't want to get, but thanks to vaccinations, help me sell the vaccines, then you can keep this disease down to where it's not going to be as bad. It's not going to kill as many people. Of course, you're going to have some people that just don't want to listen. My sister-in-law. I got a sister-in-law that prefers to get her health information from Oprah Winfrey. And so she and I have jumped up and down and screamed and yelled and started making a baby coffin and, all sorts of stuff. I stole that idea. All right. Let's see. Pathogenesis and virulence factors. The virus in plants, especially in respiratory mucosa, trachea, and bronchial cells, travels to the lymphatic system where it starts causing nodules to form up, and then it enters the bloodstream. Once it gets there, it becomes viremia, which carries the virus to the skin and various organs. So it's in the small capillaries and venules, and it gets up near the skin. And there it causes a condition called syncytia. Syncytia, have you heard of syncytia before? It causes giant cell formation. A lot of viruses will do that. They take a mutant form of this virus and they use it sometimes in forming those hybridoma cells between a plasma cell and a cancer cell. Because what it does is it causes cells to meld together and make a giant cell that have multinuclei. So you can look at cells in culture. If I were growing tissue from a lung sample and I were to look at it under a microscope, a normal, healthy individual has a monoculture. The cells don't like to touch. They're like, don't touch me. They like to spread out and be kind of even and kind of branched, and they don't like to touch one another in culture. But a cell that's infected with this virus will be multinucleated, and they'll kind of pile up and touch one another, form almost like giant tumor cells. So you can get tracheal lavage and look for those syncytial cells, and that's a real easy way of diagnosing a viral infection. Doesn't necessarily say it's this one, but it gives you an idea that it's probably viral in origin. Either that or cancer. If they've got symptoms other than, if they've got symptoms of a viral disease, it's pretty obvious. Virus is proficient at disabling a lot of aspects of the host immune response. It disrupts the cell-mediated response by killing specific types of cells. It causes a delayed type hypersensitivity response, which causes the inflammation underneath the skin that causes the red maculopapular rash. Humans are the only reservoir, which makes it a good candidate for vaccine trials, for vaccines to knock it out. As long as you aren't having to worry about vaccinating all the monkeys in the trees, it's a lot easier to get rid of a disease. So if the World Health Organization had all the money in the world, they could go in and use hotspot. Every time a measles outbreak occurred, they would take everybody that lives within a 5-mile radius of that, vaccinate them against it, and they could wipe this disease out. It's a great target, but it would be expensive, and it would have to be done all over the world. Some of those, well, let's say, I bet ISIS fighters wouldn't let the World Health Organization come in and give vaccines right now. So that's why it's hard to treat some of these diseases and get rid of them. There is an ELISA test. It's going for IgM to the measles antigen. So you take blood serum from the patient. You have IgM in the blood serum because it's got all kinds of antibodies in there. And it will bind to antigens in the ELISA test, and then you just check and see if it was there. MMR vaccine does contain live attenuated measles virus. What does that mean? What is attenuation? Tame, lazy. They've killed or they've weakened the virus somehow. Methods they used to use a lot was mercury. That's the big argument with kids forming, autism, was the use of mercury. They don't use mercury anymore. A lot of the measles strains that they use now are genetically modified. They've removed a factor from the genes of this thing, so it can't give you the disease. It's better if they can hit it with an acid or hit it with a base and weaken it, because you get a better response. So that if you remove the genes, you don't get the same reactions. The difference between a live vaccine and a dead vaccine. The dead vaccine, the dead virus is not going to try to infect your cells, so you don't get a good cell-mediated response. It's more of an antibody response. Where if you use a live, even though it's an attenuated virus, it's going to try to infect cells, and then you get both a antibody and a cell-mediated response. So it's much better. There are a few vaccines. Polio vaccine, Sabin and Salk were the two biggies. What they have is one guy developed a vaccine using killed virus, and one used modified live. So the current method of vaccinating for polio is to give 2 doses of the killed and then follow up with 1 dose of the modified live. So you get the best of both worlds. You've got some immunity before you hit them with a modified live. The fear is always that attenuated measles virus will mutate back and cause the disease that you're vaccinated against. 1 in 100 million cases, you might get a small outbreak. All right, recommended for healthy children. Let me underline the word healthy there. Don't ever give vaccines to children that are running fevers. Healthy children aged 12 to 15 months. Wow, that is a little earlier. Okay. Measles, reducing fever, suppressing cough. This is all you can do for them. Is these are not really affecting the disease. It's just making them feel better. Replacing fluid loss. Keep them hydrated. Have them drinking lots and lots of water or Pedialyte or whatever the thing is that has a lot of electrolytes in it. Pedialyte's the one that I think is out there. If they won't drink anything but a Coca-Cola, and I know Coke's full of sugar and everything, it gives them a little bit of quick energy. So just get some stuff into them. I prefer Pedialyte. Vitamin A supplements can work. B12 shots. Some doctors will give a B12 shot. Not that it does a whole lot. It just makes them feel better. It's like getting the corticosteroids. There's not many reasons to give corticosteroids except bronchitis. But corticosteroids do make most people feel better. They make me hungry. The day I got that corticosteroid shot, I could have eaten a horse. I went home and cleared out the refrigerator. Mm-hmm. That's true. I've heard that. I don't know. I'm not sure if the ginger, because ginger root has a lot of medicinal properties to it. Yellow root, if you've got some really old people, my grandfather was an herbalist. I wish now that I had learned from him. But hated it growing up. If I got sick, here he would come with the most god-awful tasting stuff, and I would have to drink it. My mom's like, well, it can't hurt. Go ahead. You know, it can hurt when your lips turn inside out and you're just, ooh, it's nasty. I never faked being sick because he lived close enough to walk down there and give me something. Ooh. But yellow root was the other one. So there may be something to it. I just don't know if there's been any studies or anything. You're right. I like looking back at some of those old folk remedies and see what happens. Ginger ale has ginger root in it. You ever cook with ginger? I love cooking with ginger. I stir fry a lot. And ginger just adds some pop to it. So cook a lot of Korean dishes. So the ginger root has a lot of medicinal treatments for it. I used to say you could grate up the ginger root and put it on infections and it can kill the infection. There's all sorts. It's really cool. If any of you are interested in botanical medicines, folk medicines and things like that, Dr. Triplett does quite a bit of stuff. There's one called bloodroot or blood something. If you break the stem on it, it's got a bright blood red stuff coming out of it. And it's extremely good at treating arthritic symptoms, according to all the current research. Most of our medicines came from plants to begin with. Aspirin, not the antibiotics necessarily, but a lot of the medicines came from botanical origins. Ginger ale, that's what she was saying. Because they were saying that if you have kids, break out the ginger ale, make them drink ginger ale. I think it really helped hydrate and probably had electrolytes and made them feel better because there's some sugar in it. I don't know if it has any medicinal value or not, but you're right, that is a common one. Rubella, postnatal rubella, rash, pink macules and papules. Papules kind of stick up a little more. Macules are kind of flat. Face and progress down the trunk. See, you can have congenital rubella where the fetus comes out and it was infected while it was inside the mother, and it's pretty much the rash is everywhere already. Where you have postnatal, and it usually starts at the head and works its way down. So I'm not even going to go there. Usually resolves pretty quickly, milder than measles rash. Adult rubella is characterized by joint inflammation and pain rather than the rash. The problem with rubella is it's teratogenic. You know what a teratogen is? So somebody could read it. Yep. It causes harm to the fetus, but it causes mutations. Teratogens can affect the fetus. In England, well, it was all over the world, but England was the worst hit place. They had a drug came out, and it was for mothers that were having morning sickness when they were pregnant, and they had tested this drug 6 ways from Sunday. They had tested it every way they could think of on adults. But when the people started taking the medication to stop the upset stomach and all that, the morning sickness, it started causing babies to be born with no arms or no legs. It was teratogenic. It affected some developmental procedure that was going on. So that's basically what a teratogen is. Virus is transmitted from mother to fetus in utero. Even if the mother is asymptomatic, she can be a carrier. Infection in the first trimester can cause, especially in the first trimester, you're going to frequently have miscarriage or multiple permanent defects. So you can have, you've heard of hydrocephalus, which is waterhead babies, flathead babies where no brains formed, and it looks almost like the skull collapsed because there was nothing inside there. Those babies usually die within a few hours of being born. Let's see, all sorts of mental and physical retardation, carditis, which is heart damage, bone infections. These can be pretty bad. It's a rubevirus. It's in the Togaviridae family. Toga. Sorry, that's how I remember it. Okay. There's only one serotype. Humans are the only host, so this is another good one to target with vaccines. If we can get everybody to become vaccinated, we could wipe out this disease, just like smallpox. Problem is we can't get everybody to get vaccinated. Let's see. It does induce apoptosis in normal tissues. Can cause irreversible harm to organs. So it goes in, it especially affects organs in the vascular endothelial system. So it can cause poor development because it's affecting the blood flow into those developing organs. Worldwide distribution. Virus is shed through prodromal phase up to a week after the rash appears. So once you get the rash, you wait a week and then you can start going out in public again. But while you're running you're not feeling good, you can be infected. You begin running a little bit of fever, and up to a week after that, you can still be infected. So don't send your kids to school with the fever. It's hard to do. A lot of us have busy lives. I got to go to work today, so you give your kid a children's Tylenol in the morning to dump the fever in. At least give me 4 hours of work time. Okay? But they can still be infected even if you are suppressing the fever with the children's Tylenol. So try to make other arrangements if you can. And you don't know what it is when it's in that prodromal phase. It's just fever and they don't feel good. You can't tell that it's going to be something major. Hopefully your kids have been vaccinated so it won't matter. So it's not very communicable. Got to have close living conditions, but if you have kids, you know that is a close living condition. They are up in your face all the time. I never forget my father-in-law fed my daughter her first Thanksgiving, and he was feeding her from the table. She was, I don't know, 10 months old or something, and he just fed her full, and he held her up and shook her like this. She propelled vomit all in it hit him right square in the face and went all over him. And I had warned him the whole time, you don't need to be feeding that baby that much. But then he took her and he was playing with her. It's like projectile vomit, just hit him right in the face. We swap spit. We swap more spit with babies. You can't help but kiss them when they're little and they've got some saliva all over them. So yeah, it can be spread. Fewer than 10 cases in the last several years thanks to vaccinations in the U.S. In culture, it mimics a lot of other diseases. Has an IgM antibody. I doubt you'll ever run into this disease. I hope you never do. Vaccine can be given alone, but it's frequently given with that MMR vaccine. That's the most common way of doing it. And most of your pediatricians like the MMR because it gives you that triple response all at one time. All you can do if they come out with the disease is just try to treat the symptomology, try to make them feel better and keep them hydrated. Erythema infectiosum, this is Fifth's disease. This is the one, it was a fifth of diseases at the time when it was discovered, recognized by doctors as a rash in children. There was scarlet fever, measles, rubella, some other rash that didn't have a name at the time, and then Field's disease. Signs and symptoms, mild disease. They call it slap cheek syndrome. You'll see some kids, they get real red rash-like appearance right on the cheeks. Looks like somebody's been slapping them. It's not necessarily true. Don't call DHR yet, okay? Within 2 days, the rash spreads to the body, but it's most prominent on the arms and legs and the trunk. So usually right here and then down on the lower legs. Rash may occur for several weeks, can be brought on by activity that increase body heat. So you don't want to give them hot baths. If they've got Field's disease, rash, give them lukewarm baths. It's caused by a parvovirus. Now, parvo is one we see in dogs. This is not the same parvo. You can't get parvovirus from your dog. But this is parvovirus B19. It's a strain that infects humans. There's another parvovirus that's really bad, but this is not it. It's very contagious. You can be contagious even without running a fever with this particular Field's disease. There's no vaccine or no treatment because it's a very mild disease. Nobody's ever really concentrated on trying to develop a vaccine. Signs and symptoms, maculopapular rash. 70% of the cases proceed without the rash stage. So usually it's accompanied, here's the most dangerous part. It's accompanied by high fever. So you can get seizures during that high fever response. And it usually occurs over just a few days. You'll have the high fever. So you want to try to keep the fever down a little bit. There's one case where children's Tylenol would help bring the fever down a little bit. You don't want usually if I get above 102, I'm seeking medical attention for my kid, you know. And if it's running up above that, then it gets scary. I remember setting up worried to death, washing a baby and rubbing alcohol, just try to get that fever down because it evaporates off. Herpes viruses, herpes is forever. Can remain latent in the host indefinitely, occasionally reactivates in childhood or adulthood, can cause a mononucleosis-like symptoms. Frequently it's misdiagnosed as that because doctors don't necessarily look at it. You know what? Let's stop right here. It's time for you to go. I'll let you get on out of here. Thank you.
I was trying to find, I don't think my brother had it. Okay, whenever my brother was born, like maybe 7 months